Hello TeamPhoenix and welcome to my YouTube channel. This is your girl Catherine Maina. Please call me Kate Mimi. It has been a while since we last spoke. A lot has gone on in my life. I will be updating you about that in due course, just not today. I want to update you on what happens when one becomes a renal nurse in the United Kingdom. Because last time, if you remember, if you watched the very last video that I made, I told you that there are very many subspecialties within renal nursing, and most of you have been reaching out asking me, oh Kate, do I need to be a renal nurse in Kenya for me to be a renal nurse in the United Kingdom, or what happens? So this video is simply to update you. Thank you for your continued engagement with me. Thank you for subscribing. Thank you for liking. Thank you for sharing. And major thanks to Dave Kim 254 Studios for making this happen. So let's talk about it. So you're there. Number one, I'll talk about people who have already specialized in renal nursing in Kenya. So that means that you had a whole 1 year higher national diploma training in renal nursing. And then you want to come to the United Kingdom. So where do you start? Just like me, I started in a nursing home. Probably you're going to start in an NHS hospital or maybe a private hospital. Now what you do is, remember, in Kenya, when we say a renal unit, we're talking about a hemodialysis center. In the United Kingdom, there are very many different places where kidney stories happen. Number one, you can work in a hemodialysis unit. Okay, so all you need to do is apply for a job in a hemodialysis unit. I tell my people, or the nurses that I mentor, that always show that you're willing to go the extra mile. Remember, you do not have any renal nursing experience in the United Kingdom, none at all. Even if you've done renal nursing for the last 20 years in Kenya, they will not recognize it as much because they do not trust you yet, okay? So you have to prove yourself that you're willing and you're able to go the extra mile. So, for example, you are there in a surgical ward and you're wondering, oh my gosh, I really want to go and do hemodialysis. What do I do? My challenge to you, or my advice to you, is please write to the hemodialysis manager, the nurse in charge. Tell them, oh, by the way, I have some hemodialysis skills I'd like to practice. Is it okay if I come during my free time? And then go there, learn, show them what you're capable of. And then when a job opportunity comes up, apply, and I dare you, you're going to get it. That's number one. Number two, you can just apply directly, just like any other nurse who has not specialized in renal, and they're going to give you a chance because they will train you in everything to do with the machines, okay? Now, that is one thing you can do as a renal nurse in the United Kingdom. Number two, you can become what I have been for the last 1 year and a half, that is an advanced kidney care nurse. Now, what you do in this case is for the patients who are in stage 4 and stage 5 of chronic kidney disease, and they are yet to decide what modality of treatment they want. Remember, we have different modalities of care. We have hemodialysis, we have peritoneal dialysis, we have kidney transplantation, which is the gold treatment for kidney disease, and we have conservative care. So patients will come in, and probably they have just been told by the nephrologist, oh, your kidney function is 19%, and you need to make up your mind on what modality to go for, and the patient is just confused. They do not know what this means. What does this mean for their lifestyle? What does this mean for their life? Are they dying? Are they going to have a kidney transplant? Is it tomorrow? When is it going to happen? So you are the gatekeeper of that information as an advanced kidney care clinical nurse specialist. Your role is to educate the patients. Your role is to help the patient navigate through the complex medical jargons that are used by nephrologists and other specialists. You are the one to help this patient look at their lifestyle, look at what is important for them, and then help them make an informed decision whether to have dialysis, kidney transplant, and whether not to. And remember, you're not just dealing with the patient, you're dealing with their relatives, you're dealing with emotions, my friends, you're dealing with... I've done this job, let me tell you, for the last 1.5 years, and I would do it again. I would do this job over and over and over and over again, because these patients are in their most vulnerable. They don't know what to do about kidney disease, and here you are helping them navigate. And one day you meet them and they have a kidney transplant. They are doing so well. Oh my gosh, you feel so happy that you've been part and parcel of that process. Another role that you can take, or another subspecialty, is what we call chronic kidney disease. I know how that sounds. As a renal nurse, you're wondering, isn't that what this is all about? No. You can have a role in the clinics as a chronic kidney disease nurse. where you're helping patients understand what to do with their medications and things like that, prevention of infections, all that is happening within the chronic kidney disease clinic. You can even go further and be in the primary care, where you're working with GPs or with communities and helping them manage diabetes, helping them manage hypertension with a view of chronic kidney disease. That is your role. You can also become an acute kidney injury nurse, where you focus on nothing else apart from acute kidney injury. It does not matter the cause, whether they are in maternity, whether they are in ICU, whatever. You are the acute kidney injury nurse. It is a subspecialty. You can become a peritoneal dialysis nurse. You can become a home dialysis nurse. And remember, when you talk home dialysis, you can do home hemodialysis or home peritoneal dialysis, whether it is automated peritoneal dialysis or continuous ambulatory peritoneal dialysis. That is up to you. You can become a kidney transplant coordinator. And remember, you can either be a cadaveric kidney transplant coordinator or a living donor kidney transplant coordinator. You can even become a ward nurse, whereby we are nursing patients who have renal conditions. You can go further and become a renal specialist in an ICU setting. This is the job that was being touted for me, but I have run away from it. I've done ICU for the last 6 months. Yes. I left advanced kidney care clinic and I went to the ICU. So I've interacted with patients when they are doing CRRT, and oh my gosh, I loved it. So this is a role that you can take, whereby you do a job share. You are an ICU nurse and also a renal nurse specialist at the same time. What I'm trying to say in so many words is that possibilities are endless when you are a renal nurse. There are so many roles that you can take, so many of them, and it is all about believing in yourself. It is all about trusting the training that you received in Kenya or even here, and going for it. So thank you so much, and I hope this video helps you know your endless possibilities. As always, shout out to Dave Kim 254 Studios for making this happen. If you have questions, please reach out to me. Write to me. All my socials, I'm going to leave them in the description box. Reach out to me and I will be happy to guide you through the process. So until next time, guys. Ta-da!